Welcome to the Loudoun County Health Department quick training for the Vaccine Administration Management System, or VAMS. In this video, we'll review the steps to document COVID-19 vaccine administration to a vaccine recipient at a COVID-19 vaccine pod clinic using the VAMS system. COVID-19 vaccine pod clinic vaccinators will use the Manage Appointments tab in the clinic portal of the VAMS system. To access the Manage Appointments tab in the clinic portal of the VAMS system, first log into VAMS. Once you've logged into VAMS, you'll need to access the clinic portal. You'll need to select the clinic that you would like to access. In this case, we've created a mock clinic called the Loudoun Health District Clinic. On the day of the actual pod clinic, you will need to select the name of the pod clinic that you are working at on that day. As a vaccinator at the pod clinic, you will work out of the Manage Appointments tab on the second to the left in the clinic portal. To access the vaccine recipient's record, go to the Manage Appointments tab on the home page. To find the recipient, you can use the drop-down table header to look at today's checked-in appointments or checked-in recipients. You can also search for an appointment by entering the recipient's information in the search bar at the top right of the appointments table. After finding the right recipient, click the recipient's name. Verify the recipient's identity by confirming their name and date of birth, and then select yes or no on the confirmation screen. If you select yes, you'll be taken to the recipient record. If you select no, you will go back to the previous page. Review the recipient's record. Review the recipient's record before deciding to administer the vaccine. At the top left of the recipient record, you will find basic information about the recipient: name, gender, date of birth, etc. In the notes section, you can log information about the recipient that may be helpful to another healthcare professional in the future. To log a note, click New Note in the upper right corner of the page. Once you add your note to the pop-up window, click Done. The name of the healthcare professional who created the note will be linked to the note and will be visible across follow-up appointments at your clinic or others. You can delete a note that you've created by clicking the drop-down arrow next to the note in the table, then click Delete. There are 4 tabs with information to review prior to administering the vaccine: pre-vaccination questionnaire, recipient details, medical information, and then go to the Vaccine Administration tab. Review the pre-vaccination questionnaire tab. This contains information relevant to the appointment, such as allergies, current medical treatment, patient's health status today, etc. Click on the recipient details to review the recipient details tab. This contains information such as name, gender, mailing address, race, ethnicity, and preferred method of communication, etc. Click on the Medical Information tab. This information contains information such as current medications, health conditions, known allergies, insurance information, etc. Once you have reviewed the pre-vaccination questionnaire, recipient details tab and Medical Information tab and have provided the EUA fact sheet before you have administered the vaccine to a recipient, you can then click on the Vaccine Administration tab and select Log Vaccine to begin the process of logging the vaccine administration. On the Assess Recipient Condition tab, respond to both questions on the screen, then click Next. After confirming you can administer the vaccine, you'll progress to the Enter Vaccine Info tab where you can select from two options to enter vaccine information. You can either log vaccine information with a 2D barcode scanner or log vaccine information manually. In this exercise, we'll log the vaccine information manually. To log vaccine manually, select Enter UOU vial information manually, then click Next. Select the manufacturer from the drop-down menu. Select a product from the drop-down menu. Select the UOU or vial lot number. The expiration date will pre-populate and cannot be edited. Then select Next. Review the summary of the vaccine information entered and select the site for the vaccine administration. For example, the left arm from the drop-down menu. Then click Next. Indicate if the vaccine administration was successful. If the vaccine administration was successful, click Yes, then click Next. If the vaccine administration was unsuccessful, click No, and then click Next. The system will ask questions to determine the possibility of reattempting vaccination. If it is possible, you'll be redirected to the Log Vaccine page where you can re-enter the vaccine information. If it's not possible, the system will ask you if wastage occurred. If yes, click Yes if wastage occurred and No if wastage did not occur. Then click Next. Select a reason from the drop-down record, a reason for unsuccessful vaccination. Once you log the vaccination as unsuccessful, the recipient receives an email from VAMS at cdc.gov prompting them to schedule a new appointment. If the vaccine administration was successful, select Yes and click Next. If no wastage occurred, click No and select Yes. If wastage did occur, you'll click Yes and log the waste. You can log the wastage information by following the same process you followed to log vaccine information prior to administration, by scanning the barcode or by adding it manually and then clicking Next. Assuming there was no wastage, we'll click Next. Notify the recipient when they can get their second dose of vaccine. If no further doses are required, the pop-up window will state that all COVID-19 vaccine doses have administered. If a second dose is required, the vaccine data entered in the system will determine the date the recipient is eligible to receive their next dose. This date will be listed in the following screen, and you can relay that information to the recipient after administering the vaccine. VAMS sends a notification to the recipient that includes the date they're eligible to receive their next dose, along with a link to schedule the next appointment on or after that date. You can inform the recipient that they can access their vaccination certificate from the recipient portal of VAMS. You can also view the vaccination certificate by clicking the hyperlink text on the confirmation page or by accessing the recipient record. You can also see a downloadable PDF of the vaccine certificate on this VAMS page. Once the vaccination has been successfully administered, you'll return to the homepage of the VAMS clinic portal by selecting the VAMS logo, return to Manage Appointments, and then begin the process again with the next recipient.